Hohenberg, naturopath and FX Medicine Ambassador. We are here today at the 2025 ATMS Healthy Brain Symposium. With us today is Dr. Mark Hohenberg, who spoke earlier today. Welcome.
Thank you, Emma.
So great to have you here. One key question that I had for you was, what is the difference between Alzheimer's and dementia? Because this can be very confusing, and I know that you broached this in your talk.
I did. So it's a great question, one that comes up nearly every time I diagnose or see patients with cognitive impairment. So firstly, losing memory, losing cognitive function is not part of normal aging. And I talk about that in the talk. It's always due to a disease. And that's a big misconception in our communities. But dementia is a syndrome where your brain doesn't function properly, and it causes problems with your loss of ability to do things in your day-to-day life by very definition. So pre-dementia, you may not have that loss, but can still have the disease. Alzheimer's disease is the disease process that can lead to dementia, and it's one of about 200 different types of diseases that can lead to forms of dementia, which have so many and a myriad of different symptoms associated with it.
It does get complex, it really does. When you did your talk this morning, what were a couple of key takeaways that you can share with us?
So I think one of the most important things with the diagnostics of dementia is to ensure there are no reversible causes of cognitive impairment. And so many of these might be vitamin deficiencies, they might be problems like sleep apnea that I'll see quite commonly. But one of the most common is problems with anxiety and problems with mental health issues. So as an example, when I see people, a younger person will say to me, I can't remember anybody's names, that's because their phone's glued to their face and they can't remember anything because they're not paying attention. But the paying attention is what the issue is with anxiety and depression, for example, because if you're not paying attention because your brain's going at 100 miles an hour, or it's not switched on properly with depression, the information's not being encoded, put in, which not being stored because it never went in, and therefore when you come to remember it, you're not going to be able to remember it later. So treating those diseases will often fix problems with cognition, which makes it reversible. So for me, that's a very important point. And the other one, really the big take home that I thought was actually to try and make sure that when you're supporting someone with dementia, remember it's not a static disease, that people will change over time. Your diagnosis initially may change and may be a second pathology, like a vascular dementia that may occur later with different symptoms, or you may develop new problems as the disease progresses. So it's always important to go into it with an open mind, and if something isn't quite right, then seek out colleagues and work with other people to try and get the best for your patients.
Words of wisdom. Thank you so much for joining us today. I really appreciate your time.
Thank you for having me. It's a real privilege.
Thanks for joining us today. Don't forget to connect on our socials and head to our website for all of our incredible practitioner education.